name is Dr. Gregory Ganda. I'm the County Executive Committee member for Health or Medical Services, Public Health and Sanitation. Today we are here closing our conference, Transforming the Landscape of Sickle Cell Disease. Now, this conference was conceived by our governor after taking note that there is a high percentage of people who live within this region who are affected. That means that 20%, almost 1 in 5, have a trait, and 2% have a disease. And that's quite a large number. But another thing was that we think, and from statistics, is that those children who end up born with sickle cell, most of them don't make it to their 5th birthday. Almost half of them will not make it to their 5th birthday. So this conference was a convergence of ideas, a convergence of all the people who are concerned about sickle cell, about treatment, including the Ministry of Health, county governments, stakeholders, research institutions, warriors and advocates for sickle cell and hemophilia. So it was a 3-day conference, converged, had great discussions in several themes. We had 4 thematic areas running at the same time, and we've come out with resolutions out of this conference. I just mentioned 2 or 3 key resolutions which I came out with. Number 1 is that people who live, or warriors who have sickle cell disease and hemophilia, need to be considered as people living with disabilities and get the benefits, because they spend a lot of time when they're sick, they spend a lot of money, and they are not treated the same as those ones who are treated as disabilities. So they have to compete with jobs with other people, and yet they are more affected and they have other disabilities which are not considered. The second thing is that we need to come up with a comprehensive program for sickle cell disease and hemophilia. That means early diagnosis, particularly for sickle cell, which is very prevalent. But we need to have newborn screening for sickle cell disease. We need to have comprehensive programs, including counseling for relatives and patients, including medications for them to grow up, and including follow-up clinics and specialties and people, healthcare workers who are trained to be able to take care of them throughout their lifetimes. I call upon residents who live or have been brought up or are related to people coming from the high burden areas, that is the Lake Region areas and the coastal regions, to get tested. More so if you are adolescent, because you know at one time or the other you're going to get married and you want to have children. Please get yourself screened. Before you get married, get screened. Let to know your status. Are you a sickle cell carrier? Are you sickle cell or you don't have? Because that will determine how you bring up the next generation. That will help you to make informed choices on how you're going to get your children. And finally, our theme, yes we can. Yes we can.